Good morning, everybody. Welcome to another episode of Health Discourse with Sushant and Sakshi. So, today we will be talking about oral health, and our focus is going to be about, oral microbiome. Because, what we have seen that currently these days in the market, there are so many products and so many claims that some products they kill up to 99.9% of germs. So, good morning, Sushant. Welcome to this episode. And let us begin with first understanding that why oral diseases are increasing among people despite having so many products in the market.
Okay, a lot of these products, whether it's mouthwashes, toothpaste, oral hygiene products, right, all work against the tiny little organs which are there to protect us, the oral microbiome. So for people who may not know, right, uh, we have microbes in our mouth, right, and these microbes are not as much diverse as gut microbiome is, but it is much more dense than gut microbiome, right? And these hold key to a lot of oral health issues and even systemic health issues, right? So you may surprised to know that a lot of these microbes in the mouth can even make us develop hypertension, cardiovascular disease, type 2 diabetes, erectile dysfunction, dementia, a lot of these issues, right? Despite of all these products, uh, why we are actually suffering from oral diseases, right, is we have to go back fundamentally to some important aspects. One is, our toothpaste, right? So when we look at toothpaste, there is a lot of fluoride in our toothpaste. There are a lot of fluoride in our municipal water supplies, right? There are a lot of fluoride even in mouthwashes, right? So the problem is this fluoride which is not found inside our body, which is not a neither a vitamin, not a mineral, right? So this is something which goes back to a few decades back when some scientists found that these fluoride would help in having fewer cavities, right? So that was the reason, fluoride was start putting in municipal water supplies, right? And uh, that did a lot of damage, right? So a lot of fluorosis happened. So again, if you are taking too much of fluoride, probably you have the brown spots on your teeth, right? And again, you have to understand that fluoride is, as I mentioned, is not a mineral. It is an antiseptic. It is antimicrobial substance, right? So, that is one of the reasons why we are putting fluoride. But if you see, uh, fluoride is electronegative, right? So it is actually, it combines with a lot of other minerals such as, phosphate, phosphorus, right? Calcium, sodium, right? And it actually uh, penetrate down in your teeth, in your enamel, and that creates a lot of trouble, right? Uh, One aspect is that it can get into your bloodstream, right? It enters into any of all of your cellular processes. It can impact your metabolism. It can cross the blood-brain barrier and reach to brain where it can impact, your brain development in child, the IQ levels in child, right? So there was a research which was found that people who there's an inverse relation between fluoride and the brain development of the child, right? So essentially, if you're taking too much of fluoride, right, it is actually cause impacting the lowering the IQ of children, especially in male child. It is twice as much as female child, right? So that's again a research which came, right, and again it is not biocompatible, right? So it kills a lot of germ. It disrupts your oral microbiome, right? And again, it is said to even cause arthritis. It enters into pineal gland, and It is said to reduce your melatonin levels, right? So you have sleep issues, you have low thyroid functions, you have pain, even increased risk of bone cancer, right? Arthritis, right? So brain issues, IQ issues, right? It's a neurotoxin, so there's a lot of neurotoxicity. It triggers a lot of production of ROS, reactive oxidative species, which is oxidative stress. So that triggers a lot of inflammatory activities inside the body, right? So one of the reason is again uh, fluoride, which is found in all toothpaste, right? And another aspect which have to be considered here is that you know it creates your environment of your mouth less acidic, right? So when you're it's sorry, it means it makes more acidic, right? So it reduces the pH level, right? So when it's more acidic, it becomes a breeding ground for a lot of pathogens, and then there's a lot of inflammation which triggers, right? So fluoride reduces to the extent of saliva pH level of 4.5, right? So that is something to be really worried, and fluoride is said to disrupt oral microbiome, as I mentioned. So it is said to cause a lot of metabolic health issues as well, such as elevated blood pressure and a lot of these things. Right? So that is one of the reasons why we may have less cavities, right? But in an individual, because this said people, doctors and scientists assume that it is going to cause less cavities, but it has determined impact on various metabolic processes inside the body.
So basically, fluoride, whatever research they did with fluoride, it was only in isolation. They did not see what other impact, what
Yeah,
kind of impact it is, doing on the other parts of the body, right? So I
yeah,
think I have another question here.
yeah.
From a layman's language perspective, what can
Hmm.
we do to, remove excess fluoride from our daily lives? Uh, what are
So
the steps that we
we
can
have to
take?
understand another thing here. So essentially, what fluoride does, that is important to understand that it is, as I mean, it is electronegative, so it is attracted, right? So it gets into all cells and tissues, and it what it does is, so along with calcium or sodium, it gets into a lot of these tissues and calcified tissues, and it does a lot of it impacts your enamel, your dentin, right? A lot of these things. So before that, you don't understand there is another mineral. Again, understand the importance of saliva, right? Saliva is really, really important. It harbors our oral microbiome, right? And it is required to regulate our oral microbiome. So there's a lot of minerals in our saliva, such as phosphate, calcium, sodium, and one of the important is hydroxyapatite, right? Hydroxyapatite, now you understand hydroxyapatite is, 97% of tooth enamel is made up of hydroxyapatite. 70% of dentin is made up of hydroxyapatite, and 67% of bone is made up of hydroxyapatite, right? So hydroxyapatite is found in saliva. So whenever you eat something, there's lots of minerals, but there's a lot of saliva helps in remineralization in your teeth, so that so transferring of the minerals to teeth, so that your teeth health, your bone health, your teeth health is good, your gum health is good, right? So essentially, hydroxyapatite plays a key role. Now, when you're taking fluoride, fluoride is actually replacing hydroxyapatite, right? So it's fluoroapatite, and it makes your enamel weak. It reduces your saliva pH level, right? And at the critical pH level between 4.5 to 5.5, your biofilms, right? Again, it's a structure inside your mouth, which if it's more, it triggers a lot of this inflammation. It is like a den and cave for these microbes to stay to support each other. There's a lot of biofilms, so there's a lot of this growth of pathogens and also. So biofilms actually start converting your processed carbs and your sugar into acid, right? It makes acidic environment, and it leads to growth of a lot of pathogens, right? So that is again, important to understand that our body does not have fluoride, our body naturally has hydroxyapatite, which is required for maintaining the balance of oral microbiome, for maintaining the healthy tooth, healthy oral health, right? But having fluoride is something which is uh, which is impacting our ability of hydroxyapatite, is impacting our saliva, impacting our remineralization, impact. It is directly weakening our enamel, so there is a lot of issues of oral health, right? And as I mentioned, fluoride is linked to a lot of these thyroid, melatonin issues, right? Metabolic issues, right? It alters your metabolism. It is a neurotoxin, enters your brain. Even, it can even cause your during in case of pregnancy, it can cause your placenta barrier and can impact the IQ level of the you know child, right? So that is one thing.
So,
Another
can
as
we establish one fact that the cases of autism, that is observed since the childhood? So, fluoride is one of those reasons,
there,
can we
there's
say?
no definitely research as of now, right? But it does impact your brain, it does impact your IQ levels, right? There's established research on it, right? But if it does your brain, there is a chance that, I'm not sure whether there is a research on, connecting the uh, fluorosis with autism or
Autism.
right or
Since
dementia.
what
I'm
we
not
have seen, that it starts at an early age. I mean, among children, it is visible during, first, during the critical first and second year of their
See,
development, right?
see, I'll tell you what is
So,
happening is I'm not sure that this happens in India, but there's a lot of these paint on the teeth, garnish of the teeth, right, of fluoride, which is done, right, to, on the assumption that fluoride is required for healthy teeth and bone, healthy teeth, right? So that is again, that is not natural. So if that is consumed, absorbed, or that is. So that can trigger, it can be absorbed by child during childhood, can be absorbed by pregnant female, incidentally by mistake, so that's huge of fluorosis which enters your teeth, right? And it actually travels, it enters as I mentioned, every cell tissue, right? It can impact virtually every single, biological process inside the
and
body.
is it also impacting your immune system, which is very important to
Yeah,
know?
yeah, yeah. So it enters as a cellular tissue, triggers internal inflammation. It can impact, your immune responses as well, right? Again, you have to understand that hydroxyapatite, right? It is biomimetic. It is naturally found inside our body in our saliva, right? So we need to have more of hydroxyapatite, right? Rather than rather than having a lot of fluoride, right? So it is not the deficient fluoride which is causing a problem. It is excess fluoride consumption, right? Through water, through toothpaste, right? Which is causing it, right? So essentially there was understanding that it's called less cavities. So it is easy to put in water because water is free of cost, right? So it easily we put it in water, and then there was a discussion. Okay, probably we should increase the intake of fluoride. So let us put in toothpastes also, right? That's I'm not sure that was the thought process, but that is how it happened, right? And even you see the fertilizers used, right? Fertilizer has a fluoric acid, right? Which is actually dumped down into the water. Again, that leads to fluorosis inside the water. So there's a lot of these mainstream farming practices is also impacting the level of fluoride in water, right?
I think that's really something that everybody needs to consider. But yes, I think let us just stick to the question that what can we do to prevent this excess consumption of fluoride in our daily lives?
So obviously, use filters when you are consuming water, right? Don't take groundwater, but to assume that it is healthy. So you need to filter it out. So what is again to to prevent the water from getting infected? There's a lot of these bromine and chloride is being put in the water, right? So that needs to be filtered out, right? do not assume fluoride is good, so we don't need to clean fluoride. That's a wrong notion, right? Second thing is w- wisely choose your toothpaste, right? So all the toothpastes, right, have fluoride. You have to check how much of fluoride is there in toothpaste. Even there's a lot of emulsifiers and artificial sweeteners and saccharines and aspartame and as well as sulfur and sulfate and a lot of these artificial stuff which also impact your oral microbiome. So understand cavities, or if you are solving for cavities or tooth decay, it is because of your oral microbiome, right? If your oral microbiome is dysregulated, it will cause cavities. It's called tooth decay. It will cause periodontal disease, right? And again, all these bacteria inside the mouth, so fluoride disrupts your oral microbiome, right? So a lot of these bacteria could secrete certain metabolites which would cross your blood-brain barrier, could impact your brain health. It will go to your other parts. It can impact your insulin signaling. It can reduce the nitric oxide production, which is required for which is a vasodilator, which helps you regulate your blood pressure. So there's a lot of multiple issues which come into play. As I mentioned, it alters your metabolism. It enters your cells and tissues, right? So fluoride is should be a complete no, right? Look out for toothpaste which have hydroxyapatite, right? Right, which is I'm not sure whether someone is uh, using that in India, but obviously you need to find out toothpaste. So there are certain you can find on Amazon. There are a couple of them which do have hydroxyapatite, but also look at the level of fluoride. Also look at the level of emulsifier, artificial sweeteners, saccharines, aspartame, a lot of the artificial sweeteners, right? This is very important. So that is the first thing because we brush every day twice, at least twice a day, right? And we are infusing or ingesting fluoride into our saliva, right? That is important. So saliva is really important. Remineralization is important. That's a hydroxyapatite is really important, right?
And mouthwashes that have to be prevented again because
Mouthwash is a classic case of it's an antibiotic for your mouth, right? So like antibiotics and drugs, what they do to your gut microbiome is mouthwash does to your oral microbiome, right? So again, so it wipes off like it clearly claims that wipes off 99% of the bacteria, right? It kills your microbiome. It dysregulates your microbiome. You have low nitric oxide production. It triggers inflammatory. There's inflammation response, right? These metabolites can go to your brain, can do things in brain, can impact your insulin signaling, right? So mouthwash is linked to even elevating your blood pressure conditions, right? So again, mouthwash is an antiseptic, should not be taken. There's no need if you have bad breath, right? If you take mouthwash to kill off your bad breath, it is understand the underlying symptoms. Again, oral microbiome comes into picture. So a lot of these, food what we eat like cruciferous vegetables can lead to production of hydrogen sulfide, methane, right, polyamines, and urease, a lot of this. It's your oral microbiome interacting with these foods, right, and producing a lot of these odorous gases which causes bad breath, right? So, for instance, if you are consuming a lot of lentils or things which are high in polyamines, right, it can trigger polyamide production or methionine methyltractor production, right? Cruciferous vegetable, so it's not only about having onion, right? If you even radish and broccoli, a lot of these cruciferous vegetables could cause bad breath, right? Again, if you are taking mouthwashes to kill bad breath, you're just trying to suppress that bad breath, but you don't understand the underlying symptom. It will have multiple negative effects on your overall biological function, right? So again, even I don't want to get to that far, but bad breath has been linked with chronic kidney disease as well, right? So because again, oral microbiome is linked with the onset information of chronic kidney disease. Yeah.
I think these are some really useful insights that you've given. to this talk, and let us conclude this talk by a few words of wisdom for everyone. What would you like to add something in terms of
Mm.
conclusion?
So, few things. You are a container for any individual container for trillions of microbes living on inside our body. It's not only about gut, right? It's also about microbes in your mouth, right? So again, if you're just thinking that people may think that if you have bad breath, it is due to gut microbiome. It may be a flip side. So oral microbiome is also linked to colon cancer and IBD. So take care again. Your oral hygiene is as important as you're taking care of your microbes in your gut, right? It is linked to various systemic health issues, right from oral disease, periodontal gingivitis, right? Type 2 diabetes, hypertension, cardiovascular disease, erectile dysfunction, dementia, right? IBD, colon cancer, right? So take care of your oral microbiome because that's the first line of defense available against the external environment, right? So whatever you are feeding your oral microbiome, whether it is the food, whether it is, the environment you're living in, the toxins are there, which are there in the environment, it can disrupt your oral microbiome, it can trigger wave of inflammatory responses and can lead to oxygen development of single or multiple chronic health issues, right? So that is something really, really important to be considered, right? Do check the labels of your toothpaste, right? If it's high in fluoride, it's a complete no, right? Look out for other options which is low in fluoride or do not have fluoride and have a lot of hydroxyapatite. Probably you'll find NHA, which is nano hydroxyapatite, which is again a processed form of hydroxyapatite, but that's how it is. It is very tiny particles which that can be easily be absorbed and dissolved in the mouth, right? Which can remineralize your saliva. Understand saliva is really, really important, right? Your saliva have a lot of minerals like calcium, phosphate, hydroxyapatite, right? Which is required for remineralizing your teeth. A lot of these microbes and metabolites actually you swallow saliva every day or liter of saliva. It moves from your oral to your gut, right? So if your oral microbiome is imbalanced, a lot of these bacteria go to the gut and start getting function there, and that's why it is linked to IBD and colon cancer, right? So take care of your oral microbiome, take care of your saliva. Do not feed with. You have to regulate your pH level. And very important thing is that your hydroxyapatite work in a very narrow pH level range, right? So the moment you are taking a lot of fluoride, your saliva pH level goes down to 5.5, below 5.5, and it becomes uh, acidic in nature. So your a lot of these carbs and sugar converted to acid, right? So we talk of succinic acid and a lot of these, uh, these fucos and a lot of these things, pathways which we actually decode in our oral microbiome solution, right? So all these can become a breeding ground for pathogen and disrupt your microbiome. It's all interlinked. Look at your intake of fluoride, right? Do not really find that fluoride is going to do good things, right? Uh, for your body. That's what I wanted to mention. So let's finish the talk thanks Sakshi for this talk, and probably this will help a lot of people in understanding you know how to maintain a good oral hygiene. Thank you everyone.